Hello, my name is Sandy Hawkins, and I'm a compliance officer for a local hospital, making a presentation to the hospital's board of directors regarding the moral right to health care. Class HCA322, Professor Joanne Pouet, May 26, 2016. Facets of morality and healthcare. The United States healthcare system is very complex and faces many obstacles today. One of the underlying issues is the ongoing debate of healthcare being a moral right. Many argue that healthcare is a moral right and the government should adopt a universal healthcare system given the success of several comparable countries that have adopted a universal healthcare system. Despite an individual's disparities, health care should be provided to everyone, yet the U.S. has a healthcare system that is unfair to vulnerable populations. Over the years, laws and amendments have been established to improve the delivery and quality of healthcare services. This presentation is going to analyze and address the many elements and barriers the moral right to healthcare presents. Vital elements. Here are some points to consider while factoring healthcare being a moral right. I will review cultural competency, code of ethics, and medical malpractice. Cultural competency. The U.S. healthcare system serves a diverse population, yet there is an undeniable issue of healthcare disparities, which is having a detrimental effect on the health of our nation. Cultural competency is an important factor in the service and delivery of healthcare and has been recognized as a strategic plan devised to reduce healthcare disparities. It is critical for healthcare professionals to be properly educated so they can provide care to patients with diverse values, beliefs, and behaviors, including tailoring delivery to meet patients' social, culture, and linguistic needs. There are three principles that are essential to culture competence: prevalence of culture in people's lives, respect for cultural differences, and mitigate the negative consequences arising from cultural differences. Understanding cultural competence is the key to eliminating the one-size-fits-all approach and improving the way healthcare is delivered. Code of ethics. Healthcare is governed in the United States by a code of ethics. Code of ethics are not laws, but standards of conduct which define the essentials of honorable behavior for the physicians. Ethics are not optional in medicine. They are an essential and integral part of healthcare. Ethical standards promote the primary concern of healthcare, which is to improve the quality of healthcare. There is a universal code of ethics that maintain a primary commitment to the health, well-being, and safety of patients. For example, the Hippocratic Oath is a historical oath taken by physicians in which they have to swear to uphold specific ethical standards. The vision, mission, and value statement is a collaboration of where an organization is going and what they can achieve, an organization's purpose or reason for being, and principles that develop ethical standards. This is critical to the improvement of healthcare by requiring honesty, integrity, and accountability. Medical malpractice. Medical malpractice is a subset of tort law that addresses and defines an act by a healthcare professional to be negligent. In the healthcare arena, there are four elements a patient must prove in order to prove negligence, because if any of these areas are weak, then the case is not going to uphold in the court of law. Tort reform was a major focus for the Bush administration to combat the ever-rising costs of healthcare by putting stipulations and caps on malpractice lawsuits. Many consumers are under the impression medical malpractice tort reform only relates to the cost of medical, yet it actually is a policy reform directed at medical liability litigation, the reduction of medical costs, and the quality of health care. Unfortunately, medical professionals are forced to increase their cost of services to cover the higher malpractice premiums and to remain in business. Cultural competency, code of ethics, and medical malpractice, among others, all have a significant impact on the issues of the moral right to health care. Cultural competence has evolved healthcare dramatically, yet there is still a huge disparity which needs to be aggressively addressed. The Code of Ethics may not be a law, but it governs healthcare professionals to improve the quality of healthcare. Medical malpractice has produced havoc in the healthcare arena, causing the cost of healthcare to skyrocket. These are just a few among many issues that assertively address the moral right to health care.